Hey guys, I'm going to be giving a presentation on HIV. I'll go ahead and get started. A little bit about HIV. It's the human immunodeficiency virus, or HIV. It's a disease that attacks the immune system and it kills your white blood cells um, that help fight off disease and all that good stuff. So it puts you at risk. So by doing that, it puts you at risk for certain cancers and diseases and illnesses. You get sick much easier. Even the common cold, like you'll find that a lot of people with HIV catch a lot of common cold just because their immune system is weaker. Um, it eventually develops into acquired immunodeficiency syndrome or AIDS. This is the final stage of HIV. Um, and but HIV currently doesn't have a cure. However, there are some very effective ways. Oh, I just realized I misspelled that. There are some very effective ways, though, that we can fight it. One of the ways is called antiretroviral therapy, or ART. Um, ART has been shown to significantly lengthen the life expectancy of someone with HIV. However, it has also been shown to cause uh, dys dyslipidemia, or abnormal disruption of body fat, usually in the midsection. You'll see just a lot of weight gain there, and then insulin resistance. A little bit more about HIV. Uh, this can be countered with standard pharmacological interventions, so just your normal uh, drugs from your pharmacy, whatever. And in addition to that, also a healthier diet and exercise to keep weight gain from happening. And we'll get into the exercise a little bit more here in a minute. Steroids are also an option to help counter this. Anabolic steroids, growth hormone, and growth factors are some of those treatment options. Um, Aerobic and resistance training are very vital and provide essential health benefits for people with HIV. Um, and I get hold on, we'll go back to that. Some of the and one of the biggest things being is helping to keep the weight off from the weight gain that's going to occur by taking the ART or the ART. Some special considerations when exercise testing someone with HIV. Patients with acute infections should uh, postpone the exercise testing, so wait till that's over. Variability of results will be higher for individuals with HIV than in a healthy population. This is due to the fluctuation of their health from day to day, um, just because of you know, as we've said before, the increased or the weakness of their immune system. If conducting cardiopulmonary exercise tests, be sure to take you know take measures to go thorough or go through a infection control, like a thorough infection control, because HIV's, like it says here, HIV is not transmitted through saliva, but in reusable masks, as a lot of places use. Chance of infection is increased if not cleaned properly. I mean, a lot of places do clean theirs properly, but if you're dealing with somebody with HIV, you would want to clean it even, really make sure to clean it well, because um, those people are at increased risk for infection through the mouth for themselves. They're not going to give anybody anything, most likely, but they could possibly get something. And ideally, you would just use one and done masks. So, but if the prevalence of cardiovascular impairments and particularly cardiac dysfunction increases, it will require monitoring of blood pressure and the ECG. Um, some more special considerations when exercise testing. Because of the high prevalence of peripheral neuropathies, testing should be adjusted to fit the appropriate exercise type, intensity, of range of motion. So, obviously each person is going to be a little bit different, even if they're on the same level of, HIV. There's three levels, as you see here. So even if they're, you know, you've got three people on the asymptomatic level, that doesn't mean that they can all still do the same intensity and or say that they all still have the same range of motion. But typical limitations to stress testing by stage of disease of HIV. So the first being asymptomatic, um, normal graded exercise testing with reduced exercise capacity, likely related to the sedentary lifestyle. So, once if they're in that stage, they're pretty fairly normal. That's um, that the virus has not really affected them that much. When you get into the symptomatic, that's when it started to affect them a little bit more. So they're going to have reduced exercise time, reduced peak oxygen consumption, and reduced ventilatory threshold. So um, you just have to take that into account also when giving your exercise type, intensity, and range of motion. And then the third stage being AIDS, I'm sorry, will dramatically reduce exercise time and VO2 peak. Uh, Reduced exercise time will likely preclude reaching uh, ventilatory threshold, and achieving VO2 peak will potentially produce abnormal nervous and endocrine responses. So, when they have AIDS, like you really have to be just you have to pay a lot of attention to how they're feeling that day when prescribing their workout. The FIIT recommendations: aerobic is frequency 3 to 5 days a week, intensity 40 to 60% um, of your VO2 or HRR. Time, you start with 10 minutes, progress to 30 to 60 minutes a day. Contact, no real contact type aerobics, because you don't want them bleeding or anything like that. So just stick to running, biking, swimming, uh, stuff where they're not gonna get injured or start bleeding it everywhere. Resistance. Oh, I don't know how that happened. Resistance training. Frequency 2 to 3 days per week. Intensity 8 to 10 reps at approximately 60% of your 1 rep max. And time is 30 or so minutes. Just kind of however long. Uh, Really, it just said however long it takes you to do 2 to 3 sets of 8 to 12 exercises, focusing on all muscle groups. Type, no contact again, but that really shouldn't restrict you from any type of resistance training. Uh, you can still do it all, all your free weights and machines, that kind of stuff. Flexibility should follow the, normal guidelines, PNF stretching, normal static stretching. I'll move that so you can see that. And then with dynamic warm-ups, especially before lifting. Here, let me move this up here. Some special considerations for exercise training. Currently, there are no established guidelines about contradictions for exercise for people with HIV and AIDS. For asymptomatic individuals with HIV/AIDS, they should follow the FIT guidelines, but may have to work with them based on their current health status. So again, you just may have to work with them based on how they're feeling and how their health status is that day. Supervised exercise is always recommended for people with HIV, because they could suddenly get fatigued all of a sudden, or if they were to somehow get a cut and start bleeding, you know you would want to have somebody supervising that. Someone with HIV should not always report increased or should always report increased fatigue, shortness of breath, or gastrointestinal distress. Increased fatigue shouldn't affect participation, so it shouldn't really affect how they train or anything like that. But if they start to get dizzy, have swollen joints, or vomiting, if that were to occur, then some adjustments may need to be made. You may need to take their workout load down a little bit. Regular monitoring of the health and fitness of someone with HIV, uh, due to the increased chance of weight gain and cardiovascular disease. Um, in conclusion, people with HIV or AIDS need aerobic and resistance training. It helps, like I said, with weight gain and other other effects of weight gain, that such as cardiovascular disease. And then exercise, it hasn't shown any immunosuppressive effects on these people, so it's not affected their immune system in any negative way. And lastly, be aware of the potential changes in health always, especially when testing. So, you know, always be aware that they could potentially get fatigued, or that they could get sick at any moment, or whatever could happen. So just always be on the lookout for that. And that's all I got for you. Thank you.